Okay, I'm starting my 10 minutes time directly.
Yeah.
Hello, hi, Gail. I'm Dr. Prajakta, one of the doctor in the clinic today. How are you, Gail?
Yeah, I'm fine, doctor.
Yeah. So, Gail, your GP has referred you to my consultant, and he has mentioned that you are having some concerns with your period. Am I right?
Yes, doctor. Yes, yeah.
Yeah. Before that, I just wanted to ask you a few questions, and I just wanted to assure you whatever we are going to speak here will remain confidential unless you want it to be known by people. And during this consultation, I need to ask you few very sensitive and personal questions. Will it be okay with you?
Okay, doctor, for sure.
Yeah. So, can you just tell me in detail about your um, problem?
Yeah, doctor, I'm now 18 years old and I have no period at all. While my sister, she has a period earlier than me, and I'm surprised why still I don't have period.
Yeah. Okay. Uh, have you noticed any pubic or axillary hair?
Yeah, there is some there, doctor. Yeah,
And
I have that.
yeah, is your breast development normal?
Yeah, it's look okay, doctor.
Okay. And by any chance you're experiencing any weight loss, weight gain,
No, nothing,
headache,
nothing.
any breast discharge,
No, doctor.
any mass in your tummy?
I it maybe I
Okay.
don't know. Maybe there's something.
Okay. Any surgery in the past you had undergone?
No, nothing.
Nothing. Uh, would like to know about your family. You told that your sister had a period. Any other member in your family who had similar complaints?
No, no, doctor. Even my mom, she's okay. She told me that she got very earlier in her age.
Okay. I wanted to ask regarding your sexual life. Will it be okay?
Yeah, okay, doctor.
Yeah. Are you sexually active?
Yeah, doctor. I'm sexual active with my boyfriend.
And do you
That's what.
find yeah, do you find any difficulties while having sexual intercourse?
Yeah, it's look okay. It's look okay. Until now, it's look okay. No problem.
Any
But
medical
sometimes,
condition? Yeah,
yeah,
yes. Any medical
some.
condition?
Sorry. Yeah, no, nothing, doctor. No medical problem.
Okay. Any medical condition for which you see a GP?
No, nothing. I'm healthy.
And do you feel well supported at home?
Yeah. My parents is good. Yeah, yeah.
Yeah. And what about your scholastic or academic means? Are you studying?
Yeah, I'm studying at university, first year university. I'm okay with that. Yeah, I like
Okay.
my brother.
Yeah. Did you express your views regarding not getting menses with someone? Because it's quite a sensitive issue.
Yeah, I discussed with my mom. Yeah, so she advised me to come to see my GP, and then my GP referred me to you, and he did
And
some investigation,
yes.
and he
Does it
recommended.
affect, yeah, does it affect you mentally or emotionally?
Sometimes I'm thinking about is there any difference between me and my sister? That sometimes, yeah.
Oh, thank you for sharing all the information, Gail. I would like to examine you in the presence of Saffron to see your weight to height ratio. Uh, then I would like to check your blood pressure, your abdominal examination or tummy examination, and some internal examination to see.
Okay,
Yes?
okay,
Yeah.
yeah.
Regarding blood investigation and the reports, do you have any idea? Did they check?
No, they didn't tell me, but they say they did some genetic makeup and some blood hormones, and they send me that. Yeah, send me to you.
Yeah, so we have done your some blood hormones, and the most of the hormones are normal or within normal range. The only two hormones which are being secreted from the brain are little raised in your case. Okay, they are FSH and LH. Along
Yeah,
with that, we have done a genetic makeup test in your case. So,
yeah,
Gail, I wanted to explain you that a normal genetic makeup, most of the woman is 46XX. But in
Oh,
few women, we do come across with a different genetic makeup, and that is known as 46XY. And this condition, in our medical language, we call it as a androgen insensitivity syndrome. Have you heard about this terminology any time in your life?
no, doctor. Do you mean I'm a boy, doctor? Because I know from biology study that a female is usually XX. Why I'm XY?
Most of the male are, yes, there's XY, 46XY, but there are few women who also carries this genetic makeup, and this syndrome, as I told you, they are known as androgen insensitivity syndrome. And regarding feeling like a boy, I just wanted to tell you,
Yeah.
up till now, the way you have been grown up, the way you are feeling for yourself, will how you are feeling, how you are, that is going to determine what you want to be. Whatever will be the genetic makeup, if you are thinking that you are a female or if you are a girl, then you can carry yourself as a woman.
Yeah, I feel I'm a female, but I'm worried why I don't have period. That's why.
Yes, it's quite a difficult time. There are many celebrities who are also experiencing the similar syndrome, or they're also being affected by similar condition. And this is a genetic condition. It carries from one family to the one generation to the other generation. Okay,
Mm.
and that's the reason I will also refer you to a genetic counselor and a geneticist, along with a psychiatrist or a counselor. Would it be okay?
Okay, doctor.
Yeah, it's quite difficult news as of now. Will it be okay to continue?
Yeah, doctor. Yeah, continue, please.
Yeah. So having this condition, that means there is absent womb, absent cervix, and the gonads will be there. It will not be ovaries, it will be a gonads which will be producing a hormones. Absent womb and cervix means you will not be getting pregnant, you will not be able to carry your babies. At the same time, you will not able to get your periods also. Am I
Okay.
right?
Yeah, it's difficult. Yeah.
It's totally understandable. It's quite difficult. Sometimes women with this condition may experience some sexual difficulty. If you are experiencing similar situation, we can offer a help. Would you like to have it?
What do you mean, doctor, by that?
If there is a difficulty in having a sexual intercourse, then we use offer them a dilator.
Mm.
Okay. Yeah, and some counseling, psychosexual counseling sessions also. And if it is quite difficult, then alternative modality in the form of surgery also we discuss with them.
Yeah.
Okay.
Mm.
Regarding the gonads, yeah, regarding the gonads, these gonads are shown, if kept as it is, there are a possibility of turning into a sinister pathology. And that's the reason once a girl has attained a age of 18 or after that, we recommend to remove this gonad so
Mm.
to avoid this sinister pathology. And
Okay.
after
Yeah.
that, yeah, after that, we will be recommending you to start you on hormone replacement therapy along with calcium and vitamin D. Will
Mm.
it be okay?
Doctor, is it mandatory to remove it?
Yeah, because of
Surgery.
it getting turned into a sinister pathology, to avoid it, we are recommending that.
Okay. Okay, doctor.
Okay. Meanwhile, I would like to offer you certain investigations to see whether there are any other abnormality associated, ultrasonography and MRI of the abdomen and the tummy, pelvis,
Why, doctor, MRI?
to see whether there are any other abnormalities associated with this.
Mm. Yeah.
Okay.
Okay, doctor.
Yeah. And regarding this, I will be giving you patient information leaflet regarding this condition. Next time, you can have a consultation with my consultant along with your mother, and to whosoever you would like to involve in this care pathway, we will be happy to have them. DSD families and DSD teens are a support group people. Being connected with them many a times will help you out to come out of this stressful situation.
Okay, doctor. Okay.
Do you
Okay.
want me to discuss anything else?
No, doctor, it's clear.
Yeah. And thank you for sharing all the information with me. Have a good day.
Okay, doctor, thanks.
Thank you. Okay.
I get it. I get the message.
Yeah. So basically, it's a very sensitive task. We have to be very sensitive, whatever information you are going to share with the paper patient, and then explain her in a very sensitive manner. It's very difficult to explain them about AIS. Okay,
Yeah,
many uses their own terminologies, many uses, but we just need to tell them that it is a XY chromosomal pattern, and you are female. Okay,
yeah.
whatever you are feeling, it is a XY chromosomal pattern. I don't know what I missed out. Okay, in spite of having a complete 100%, but when it comes to performing in front of the examiner, it's always a difficult. Okay.
No, it's not clear. Thanks. It's clear.
Yeah. So let's go through the answer key what I had prepared, and anybody can be open to give me a feedback. Okay. So my first part is uh, okay. That is answer key is first part is actually intro, rapport building. I could have built a rapport if the patient would have been here 18, less than 18 year, okay? 16, 17, they are very teenager. Still, I means, okay, I could have been able to build a rapport. I enter into the station straight away. So rapport building can be addressed here. Once you have introduced, hi Gela, how are you? And how's the study, are you studying, okay, and how is the university or how is your school going on, some one or two question here you can ask her. So that is rapport building. Somewhere somehow you have to ask her what she's doing, okay. Situational awareness per se, it is not, I mean, the per se situation is, you know, that this is a BBN template communication task GP letter with blood investigations. So aim is primary amenorrhea referred by GP to discuss investigations, which I missed out. Okay, I just mentioned since you are not getting periods, the GP has referred you to us. Okay, or the consultant. So I could have added, and he has I mean, he has done certain investigation. We can discuss those reports also. So setting agenda. So we will be continuing this consultation. Can I ask you a few questions? Hmm? Okay. Now it is very sensitive. This is actually a confidentiality and signposting her. It is very important. It is at most important patient safety point also, that you are not going to discuss this without her permission with anyone. Whosoever she would like to involve, with those people only we are going to discuss. Hmm? Assess task. So basically it is BBN communication task. You by this time you know. Relevant history is only because, see, this is actually a clear cut station of AIS. You can ask few details about differential diagnosis just to know, means whether there are anything. But if not asked also, you might not be downgraded on information gathering. Please remember that you are having a information gathering. You need to gather information regarding AIS. You miss out on that. Aunt is having the similar situation. Her aunt is also having a similar situation. Okay. So since diagnosed AIS, hair axillary pubic hair, that is hair growth. Differential diagnosis, you can ask two or three questions: headache, excess hair growth, weight gain, weight loss, eyesight, breast development, breast discharge, anything. But mass in tummy is very important, okay, because these are having external gonads. Any surgery in the childhood, at any time. Bladder problems, yes, this I missed out. So sorry. Okay, bladder problem I missed out. Family history of similar complaints. Age of mother and sister's menarche, and yes, the aunt is having the similar problem, and she is married, no sexual problem, but yes, she is having a she's not childless. Okay, she's childless. Medicine and allergy. Sexual history is very important. Active or planning in upcoming days. Difficulties, no. So here she is not having sexual difficulties. So that part we know that we do not need to go in detail about that part of treatment. That means she is sexually active and she is not having any difficulty. That means her vaginal introital length is adequate, and we do not need to address that part. That you will, if finding it difficult, then we will discuss the alternatives or the options with her. But as of now, she is not having any difficulties. You asked me, that's the reason I enter into that domain. But if a role player will be there, she might be saying, no, I don't have any difficulty, then yes, you can just skip that and go to the next thing. Support smoke involvement of someone in her care. This patient, actually, this question I miss out. I asked her regarding her views, her mental affection. Okay, it is very important whether it is affecting her. Examination is very important here. So breast, pubic hair, which needs to be staging, BMI, BP, saffron, per abdomen, and per speculum, per vaginum, to see whether there is any abnormal swelling. Now BBN. Okay, so it is very important. Checking background knowledge about her report, checking background knowledge about AIS, whether she knew AIS. Always explain normal report first, followed by karyotyping. Then diagnosis, that is, it is androgen insensitivity syndrome. You can go in so much detail of this condition, but it will be difficult to manage the task completely. So simply keep it very simple, that a few women will have a genetic makeup of 46XY. Yes, XY, most of the time it suggests a male genetic makeup, but in few women this makeup has been found it out, and we label this condition as AIS or androgen insensitivity syndrome. There are various celebrities who are also a part of this syndrome. Okay, do not judge yourself, do not blame yourself, it is not your fault. Okay, now how you wanted, how you have felt about yourself, the way you were rearing up, the way you were grown up, you can continue to carry the same identity and do not need to reveal this till you are comfortable, till you are comfortable to discuss with other member, including your family member. Okay, many celebrities are coming up. Support group is DSD families or DSD teens. It is sometimes difficult news, so means it is a difficult news to digest. So can I connect you with the counselor, a support group, people with similar condition, so that talking to them will ease out your pain. Now here you can take a pause because we had explained her about AIS. Would you like to know in detail about the further option? Yes, would like to know. So this means that there will not be any womb, there will not be say a surgery, there will not be cervix, no ovaries, only gonads. Okay. So not will not have period, will not carry her baby, will not get pregnant on her own. She can consider adoption, or with a newer technology there is an option of uterine transplant if she asks you or probes you regarding that. Yes, there is a newer options, that is uterine transplant is available. With this condition, the uterine transplant is a newer technology, needs to be discussed by a MDT, needs to be discussed by a MDT. They will discuss pros and cons of option. It involves a surgery where a womb will be transplanted inside your tummy till you carry your biological till you carry a baby. And since it is not ovaries, you will not carry your biological baby, it will be a surrogacy. Okay, surrogacy. Sorry, not surrogacy, it will be a OM donation here. Other option will be adoption. In her case, if she asked you in detail about that, there was one recall where the patient was asking about uterine transplant. What I will be saying in uterine transplant, this is newer modalities. Only a few cases has been uh, coming up. lit, Now only few cases are coming up, but yes, the successful outcome is there. Okay, successful outcome is there. It involves implanting a uterus inside your tummy, putting you on multiple medications to decrease your immunity and continue. Okay, once this has been accepted, then referring you to a fertility specialist where they will offer you IVF, keeping you keeping you monitored throughout the pregnancy, early delivery, that is cesarean, a delivery by cesarean section, and most of the time after delivery, they will offer you removal of womb or hysterectomy in the same sitting or in a different sitting, because continuous immunosuppressant drugs carries a risk. So these are the points what you can explain if the patient has asked you regarding uterine transplant. I don't think more than this will be asked to a trainee. Now, keeping gonads still normal bone development and then go ahead with the laparoscopic surgery as there is a risk of cancer in the gonads. Once it has been removed, hormone replacement therapy along with calcium and vitamin D is recommended. So no sexual difficulties can be difficulties. So she can continue to have sexual intercourse if she asks. Okay. What further investigation here would like to do? USG for confirmation and MRI for renal or kidney assessment. Definitely, this is a difficult time for her, and if if she agrees, she can involve her mother. She can have a discussion in detail in the presence of mother, consultant. Again, I will assure you about confidentiality, MDT, that is adolescent gynecologist, counselor, genetic counseling, and GP will be in the loop. Okay. So this way we are going to complete the task. Now coming to the domain scoring, what are the important points? Patient safety, basically confirming identity. Uh, Here actually the patient doesn't need to take any informed decision. Explain why gonads needs to be removed. Hormone replacement therapy. No false reassurance. Okay, regarding the treatment. Ultrasonographic findings, no, you have to explain the reports, actually basically BBN, signposting and confidentiality, empathic way, and support group. Applied clinical knowledge, basically gonadectomy and HRT. Genetic basis of diagnosis and possible family history. Okay, so this is a condition which carries, which passes from one generation to the other generation due to a faulty gene, due to a pair of faulty gene. If the pair of faulty gene will be present, then only the person will have this condition. Offer family screening, yeah, pattern of inheritance. Okay, so we can offer her a family screening. Explain the rationale for removal of gonads and why amenorrhea. Pediatric adolescent gynecology, because of this comes under adolescent gynecology, genesis, clinical psychologist, and MDT meeting. Information gathering, basically details history of regarding her symptoms, sexual history, especially dyspareunia. Okay, examination is very important here. Examination is very important because you wanted to know a tanner stage, her breast development, and her pubic and axillary hair. Per speculum, per vaginal examination to see the length of the vulva and vagina. Okay, the length of the vagina. Discuss investigation. So here biochemical investigation they had already done up, so it is only imaging what has been left out. A certain family history, yes, there is a family history, and obtain any history regarding her anxieties with period and children, that also you can continue. Okay, communication with patient and families, rapport with the patient, explain the examination, general breast, abdomen, pelvic and vaginal investigation, what investigation we are going to offer her, explain diagnosis of AIS, discuss the management, long term implication, that means no menstruation, no fertility, and HRT following surgery. This is the implications what we are going to explain this to the patient. So overall this way we are going to discuss this task, dear. Any questions so far as?
No, thanks, Dr. It's clear.
Thank you. Okay, only two of